All right, everybody, Dr. Rafid here from Vet Triage. We are continuing February 2022 Veterinary Surgery Journal, and the article for today, comparison of 2% mepivacaine and a solution of 2% lidocaine epinephrine administered for median and ulnar nerve blocks in horses with naturally occurring forelimb lameness. This study comes out of the vet school in Auburn and the vet school in Kentucky as well. This page here talks about different peripheral nerves, and this is very cool. So you have motor nerves, sensory nerves, autonomic nerves, and they could be either myelinated or unmyelinated. And then based on these characteristics, you can divide nerve types into A alpha, alpha beta, A delta, C, and that differentiation is also based on their size, and then of course based on their myelin status and their size tells you what their functionality is. So very cool chart, and it comes in handy for this paper as well. But in general, this is a good thing to know, so I'll leave it up. Oh, and we are talking about horses here, so we'll switch it over to the horse. All right. So the objective is to compare a 2% lidocaine solution containing 5 micrograms per milliliter or a 1 to 200,000 dilution epinephrine with 2% mepivacaine for reducing lameness in horses after use in proximal nerve blocks. 6 adult horses, they measured vector sums of median and ulnar nerve blocks, were performed with lidocaine epinephrine, which is 0.5 milligrams epinephrine added to 50 milliliters of 2% lidocaine immediately prior to administration, or an equal volume of 2% mepivacaine. After 1 day, nerve blocks were repeated using the other local anesthetic. Results show that the reduction in the vector sum did not differ between nerve blocks with lidocaine, epi, or mepivacaine. The mean time to vector sum was less than 8.5 millimeters. The mean time to a vector sum of less than 8.5 millimeters was 5 and 9.6 minutes for lidocaine epi versus mepivacaine, respectively. The decrease in vector sum to less than 8.5 millimeters lasted to 150 minutes in both treatment groups. Conclusion was the outcome of the median ulnar nerve blocks performed with 2% lidocaine and epinephrine did not differ from blocks performed with 2% mepivacaine. And just for you folks to know, when you have a horse that's lame and you're trying to figure out where on the leg they're lame, obviously these are massive creatures, so you can't just pick them up and do whatever you want with them like you can with dogs or cats. So you numb certain parts of the limb, usually going from the bottom of the leg and proximally, and once the lameness resolves, you now know that the part you numbed was the source of the lameness in that horse. Ideally, local anesthetic use should be highly efficacious for resolving pain, have a reliable onset and duration, and should not irritate tissues. Local anesthetics most frequently used for examination of equine lameness are 2% lidocaine hydrochloride and 2% mepivacaine hydrochloride, with mepivacaine being favored due to superior potency and longer duration. Many diagnosticians consider lidocaine to be irritating to tissue, although local tissue inflammatory reactions elicited by lidocaine versus mepivacaine remain poorly documented. Lidocaine was found to be less potent than mepivacaine. The addition of 5 microgram per liter or 1 to 200,000 dilution of epinephrine to a 1% lidocaine solution improves potency and duration. Epinephrine prolongs and potentiates analgesia of lidocaine by stimulating alpha adrenergic receptors in the neural vasculature, resulting in vasoconstriction and reduced clearance of lidocaine from the nerve. Another study reported that when horses with foot pain received Palmar digital nerve blocks using 1% lidocaine epinephrine solution, resolution of lameness lasted for at least 2 hours, a duration comparable to that of 2% mepivacaine. Materials and methods for this study, they were all quarter horses, 2 mares, 4 geldings, 15.7 years old, 581.4 kilograms. The gait was assessed, the vector sum was measured at 5, 30, 60, 90, 120, and 150 minutes post nerve block. And the results: resolution of lameness occurred at 5 minutes post nerve block in 4 horses treated with lidocaine epi, and at 5 minutes post nerve block in 1 horse treated with mepivacaine. The vector sum for horses with nerve blocks with 2% lidocaine containing 5 micrograms per milliliter of epinephrine was not different in comparison to an equal volume of 2% mepivacaine given to median and ulnar nerves. Median time to vector sum of less than 8.5 millimeters was 5 minutes for lidocaine epi and 9.6 minutes for mepivacaine. The vector sum remained less than 8.5 millimeters for 150 minutes in 4 horses for both treatments. No adverse reactions, no abnormal physical exam findings. Rechecking at 1 month was the same. Discussion. In this study, reduction in vector sum after median and ulnar nerve blocks with 2% mepivacaine or 2% lidocaine solution with 1 to 200,000 concentration of epinephrine did not differ in horses with naturally occurring forelimb lameness. Lidocaine and mepivacaine are both amide, AMIDE, local anesthetics that function primarily by reversing blocking fast voltage gated sodium channels, preventing potentiation of neural action potentials. The onset of action is dictated by the respective lipid solubility, which in turn is determined by their dissociation constant, which is the pKa. The closer the pKa is to pH of local tissue, the more rapidly the drug crosses the neuronal lipid bilayer. Lidocaine has a pKa of 7.8, mepivacaine 7.7. So the closer they are to 7.4 pH, that's why they have a rapid onset of action. The duration of action is determined by the ability of the drug to bind to voltage-gated sodium channels, i.e. their protein binding capacity. Lidocaine has a protein binding potential of 64%, mepivacaine is 77%, which explains the longer clinical duration. Importantly, mepivacaine has intrinsically less vasodilatory activity than lidocaine and is cleared less readily because of that from the neurovasculature. A study compared the onset and duration of action of pulmar digital nerve blocks performed with a 2% lidocaine and 2% mepivacaine in an experimental lameness model and found that mepivacaine was more reliable in resolving lameness and had a longer duration. Another study looked at lidocaine and mepivacaine blocks had a similar duration, although the reduction in severity of lameness was less in blocks performed with lidocaine. Another study found that skin desensitization without resolution of lameness can occur after treatment with lidocaine, but not with mepivacaine. This finding is pertinent because skin sensation is often tested as a measure of nerve block effectiveness, and this discrepancy may confuse the interpretation of the lameness examination. The region of skin desensitization can vary between horses following high regional nerve block. Pain is conveyed to the central nervous system via myelinated type A delta fibers and non-myelinated C fibers. Administration of local anesthetic can result in blockade of pain fibers without abolition of skin sensation due to differing fiber size and degree of myelination. So what they're saying there is when you give the local anesthetic, you can't necessarily depend on if the skin is numb as to whether or not the local anesthetic is working, because you can have resolution of lameness, which means the anesthetic is working, and skin that's not desensitized. And then, of course, the reverse can happen too, where the skin is numb and you don't see resolution of the lameness because it only numbed the skin and didn't go into the deeper tissues. Previous research indicates that subcutaneous administration of 1 to 200,000 epinephrine is not likely to result in detectable changes in heart rate or blood pressure. The therapeutic dose of epinephrine for cardiac resuscitation is 10 to 50 micrograms per kilogram. The amount given to each horse in this study is 0.3 milligrams, which is an average dose of 0.5 nanograms per kilogram, which is 200 times less than the dose used for resuscitation. Some authors have cautioned against using epinephrine for analgesia because they can develop white hairs around the injection site, and then you can have an ultrasound-guided technique also described. So in this current study, the reduction in vector sum observed after median and ulnar nerve blocks did not differ between lidocaine and epi or mepivacaine when monitored over a time period of 150 minutes. So they're trying to say that they're both pretty accurate based on this study. Obviously, they need more horses. There's only 6 horses in this study. And so, and I also think too, it would have been interesting, although not required, to test skin sensitization in this study. But again, it wasn't really the focus of it. And they did go based on lameness, which is far more important because who cares about skin? If you can numb the lameness, it doesn't really matter. That's the entire point of the local anesthetic anyway. So, all right, thanks for watching. We'll see you again tomorrow. Bye-bye.